Hi there. How are you doing today? Okay. So, do you know why you're here? Exactly. I'm going to be performing a cranial nerve exam. You're nervous? Okay. That's all right. Let me just sanitize my hands. So, what I can do is I can explain what I'm doing in a little more detail. Do you think that that would help? Okay, I can absolutely do that. So, most people come to get a cranial nerve exam after a traumatic brain injury. Stroke victims can also need a cranial nerve exam. And what it is I just run a series of tests and assessments, reviewing things like your sense of smell, your ocular mobility, sensation in the face, sensation in your eyes, your head and neck muscles, your ability to hear in both ears, and your vestibular function. So a little bit just background. Your cranial nerves are a set of 12 paired nerves in your brain. Okay. These nerves help your brain and your body communicate. They communicate your senses, movement, and some communicate both. So they are very important, and we want to make sure that each one is working as it should. Yeah. So the first two cranial nerves they arise from your cerebrum, and then the remaining 10 emerge from the brainstem. So I'm sure you can imagine that the communication through your spinal cord is very important with that as well. Yeah, it's pretty amazing what our brains and bodies can do. So we really want to make sure that yours is functioning at its highest level. Yeah, that's what we'll go over today. Doesn't sound too scary, right? Okay, so the first one we're going to go over is your olfactory nerve. And what this nerve does is it transmits information regarding your sense of smell to the brain. So I have four different scents here. And I'm just going to have you give them a little whiff and let me know, what do you think it smells like? Does that sound easy enough? I thought so. So let me get my gloves on. Yeah, I know I sanitized, but it's always good to be cautious. So each of these scents are strong, but not bad. pleasant smells. So what I will have you do is just cover one nostril, okay? Just cover one side. And I'll have you close your eyes, because I don't think you would cheat, but just in case, just close your eyes and cover that nostril. I'm going to bring this a little closer to you, and I'm just going to kind of waft it towards you. Okay. What did that smell like to you? Exactly, that was peppermint. Okay. Now I'll have you close the other nostril and your eyes, so just close your eyes. And I'm going to do the same thing, okay? Just get a little bit closer and just kind of waft that smell towards you. Do you have a guess for that one? Perfect, yes. That was lemon. Now we'll go back to the other side, so close that nostril. Kind of a different scent profile on that one. Do you have a guess? Exactly, it was cinnamon. And then the last one. So close the other nostril and just close your eyes. You guessed that one right away. Yes, that was vanilla. You're right. Okay, so not too difficult, right? Not too scary. Perfect. Alright, so now what I'm going to do is test your optic nerve. And what your optic nerve does is it transmits information to the brain in regards to your vision. So do you typically wear glasses or contacts? Okay, perfect. So I'm going to do a quick little Snellen test. We're trying this digital thing here, so we'll see how it goes. Okay. I'd like for you to look with both eyes to start. Okay. I'm sure you could read that, but can you read that? Good. Can you read that? Good. Can you read that? And that. Okay. Now can you close one eye? Just cover it with your hand. Okay. Can you read that? Can you read that? Can you read that? And that. Okay, now the other eye. Let's go this way. Can you read that? And that. And that one. And that. And that one. And that. This one. And that one. Perfect. Okay. Now, I know this photo is a little bit blurry, but can you tell me what color that is? And can you tell me what color that is? What about this one? And what about this one? Good. using the digital charts that you can't tap just like you want to. Okay, so I am going to look at your eyes. I'm going to be specifically looking at your pupils. Okay, so I'm going to be checking their size. They should be the same, or at least very similar in size and in shape. I'm going to do this without a light to start. So just taking a little peek, just a little peek at how they look. Yeah, they look great. Okay. Now I have this light, so it is going to be a little bit bright. I'm going to shine this light into each one of your eyes to look for pupillary constriction and consensual response by seeing if each pupil constricts when I shine this light into the opposite eye. Right, so I'm going to start by just looking at each pupil. Okay. Yeah, so when I shine this light into your eye, there should be pupil constriction. Okay. That looks great. Yeah, everything's looking really good there. Okay. Now, when I test the consensual response, I'm going to do this swinging highlight test. Okay. Just keep looking forward. Good. Very good. Okay, that looks perfect. Everything's responding as it should. Great. Okay. Cranial nerves 3, 4, and 6. I'm going to kind of test together. Alright. So what I'm going to have you do, I'm going to test your binocular ocular motility. So I'm going to have you follow my fingers with your eyes while holding your head still. Okay? So hold your head still. Don't swing it like this. Just hold your head still. And then I'm going to have your eye follow my finger, okay? Good. Very good. Very, very good. Keep your head straight. Good. Very good. Perfect. Okay. Wonderful. All right. We're going to do that same test, but I'm going to have you cover one of your eyes. Just cover it with your hand like that. Okay, you'd rather me? Okay, so I'll cover it. And then you just keep your head straight and try to follow my fingers. My finger. Good. Very good. Okay, same thing on the other side. Good. Perfect. Wonderful. Okay, you did a great job. Now I'm going to do this thing where I am going to screen for strabismus. I'm going to cover one eye just with this sticky note, And then I'm going to cover the other one. Okay? And you can just look straight ahead at me. Very good. All right, I'm now going to test cranial nerve 5. See, we're moving right along. Okay, the trigeminal nerve. This is the largest cranial nerve, and it has both motor and sensory functions. So the motor functions help you to chew, they help you to clench your teeth. It also gives sensation to muscles in the tympanic membrane of the ear. The sensory division has 3 parts that connect to the sensory receptor sites on your face. Okay. So we have a couple of different things to go through here. All right. I am going to take this little cotton swab, and I know it sounds a little uncomfy, but I'm going to touch your cornea to elicit the corneal reflex. Okay, so just hold still. Good. I know. Sorry. Okay. See, all done. Perfect. All right. Now I'm going to take a different cotton swab. So this one, I'm going to have you close your eyes and then indicate where on your forehead, cheek, and your chin I touch with the applicator. So just close your eyes. Oh, good. Good. Perfect. Good. Wonderful. All right. Now I'm going to take 2 little cotton swabs and I'm just going to run them along your face, okay, in the same areas. And I just want you to keep your eyes closed and let me know if it feels the same on both sides. All right? Starting at your forehead. Does that feel the same? Okay, good. And then down your cheeks. Those feel the same. Perfect. And then your chin. Those feel equal on both sides. Okay, perfect. Now I have this little metal spoon. It's a little cold to the touch. I'm just going to press it in certain places on your face. And can you just let me know, does that feel cold? Okay, and where am I pressing? Good. Does that feel cold? Perfect. And where am I pressing? And here. Does that feel cold? And where am I pressing? Okay, I'm going to test the muscles of mastication. So what I'm going to have you do, I'm going to press up on your chin. I'm just gonna hold it up, and I'd like for you to try to open your jaw. Okay. All right, great. Wonderful. Now I'm going to have you clench your jaw. So clench your jaw, when you're stressed and you clench your jaw. And I'm just going to palpate the temporalis and masseter muscles. So by your temples, just going to press while you're clenching your jaw. Good. I'm just looking for, just feeling for their bulk and strength. Okay, and then the master muscles over here. Good. Okay. Then I'm going to put my hand against your chin, jaw area. I want you to move your jaw into my hand, okay? Good. And then the other side. Okay. Now can you just kind of relax your jaw? Just open it a little bit. Let it just hang. All right. I'm going to put my finger on that area and just tap. I'm just testing for your jaw jerk reflex, which could be if there's a dysfunction there, could be an indicator of an upper motor dysfunction. So very good. Perfect. You're doing great. So have you experienced any sharp pain feelings in your face? It could be on one side, could be on both. Okay, good. Now we're going to go to cranial nerve number 7. So this is your facial nerve. This nerve has both motor and sensory functions. And this center consists of 4 types of nuclei, and they all serve different functions. So there's the movement of muscles that produce facial expressions. There's the movement of the lacrimal, submaxillary, and submandibular glands. There is the sensation of the external ear and the sensation of taste. If you've ever heard of Bell's palsy, that is a disorder of the facial nerve. And that's like a big characteristic of this disorder is paralysis on one side of the face and potentially loss of taste sensation. Yeah, so we're going to be testing a bunch of different movements. All right. I'm going to start with testing your motor function. So can you just raise your eyebrows just as high as you can, like you are super surprised? Okay, good. Now can you close your eyes? Close them tightly. And I'm going to try to just wedge them open, okay? I'd like for you to resist my hands trying to wedge them open. Okay. Good. Very good. Yeah, very good. Very, very good. Strong And can you pucker your lips? Very good. And what I'm looking for with that is a complete closure of the lips. So you did a great job. And I'm just going to inspect your face for symmetry. Yeah, this could be like one side of your lip is drooping, or perhaps an eye is drooping. Perfect. Can you puff out your cheeks? And I'm gonna try to deflate them. Okay, keep puff out those cheeks. Good. Okay. Now can you jut out your lower teeth like? Can you do that? If you can't, just show me your lower teeth. Okay. Good. Alright, so now we have the sensory part of the 7th cranial nerve, and that is taste. So, this is the fun part. Not really. I asked for them to give me cookies, but they said no. So, I'm going to have you taste 4 different items for me. And the taste profiles are going to be quite varied. So I have sour, bitter, salty, and sweet. Okay? Sour, bitter, salty, and sweet. I'm going to put these tastes on the end of your tongue, the anterior 2/3 of your tongue, while your eyes are closed. And I just like for you to let me know what taste you think that is. And I'm going to apply each of these with a Q-tip. So could you just open your mouth? What do you think that is? You're right, it's vinegar. Okay. Yeah, lemon juice. Perfect. Great, that was salt. And last one. Exactly, that was sugar. You did a fantastic job. Now we are going to test like your cochlear nerve, like your hearing. So basically this nerve helps with hearing and balance, which is like what your inner ear does. So this nerve contains 2 components, the vestibular nerve and the cochlear nerve. So like its full name is the vestibular cochlear nerve, and I'm terrible at saying that. So the vestibular nerve helps your body sense changes in the position of your head, like in regards to gravity. So this helps you maintain your balance. Have you been experiencing any vertigo? Okay, that's great. That's good to hear. So the cochlear nerve helps with hearing. Within your ears are these things called inner hair cells, along with the basilar membrane. And what they do is they vibrate in response to sounds and determine the frequency and magnitude of that sound. So what I'm going to be testing today, since you're not having any vertigo, I'm just going to be testing your auditory function. So what I will do is make a distracting sound in one ear. I'm just going to do this. And then in the other ear, I'll just whisper a couple of numbers. And if you could just repeat the numbers that I said, that would be great. Okay? 4, 2, 5. Good. 7, 1, 9. One more time. 1, 6, 9, 4. Good. 3, 2, 8, 1. Very good. And did that did that sound pretty even on both sides? Okay. Very good. So because your hearing is sounding pretty normal, I don't think that we need to do any additional testing. If you were having issues, we would want to discern whether the hearing loss was conductive hearing loss or sensory neural hearing loss. But you seem to be hearing everything just fine. Okay. Now we are going to test your glossopharyngeal function, and that also has both motor and sensory functions. So the sensory function receives information from the throat, your tonsils, your middle ear, the back of the tongue. It also has a roll-in sensation of taste of the back of the tongue, so that's just kind of what we tested before. That's why I put the flavors in the front of your tongue. Yeah. So the motor division, the muscle that allows the throat to shorten and widen. So this is very important with swallowing. Yeah. So that nerve and then the 10th nerve, which is the vagus nerve, kind of go together for what we're going to do today. And the vagus nerve has a whole range of functions. It provides motor function, sensory function, and parasympathetic functions. So this cranial nerve accounts for a lot of our involuntary actions with speech and swallowing. Yeah. So the sensory part provides sensation to the outer part of the ear. I know you've heard me mention the ear 3 times because there are 3 parts of the ear: the outer, the middle, and the inner. It also provides sensation to the throat, the heart, and the abdominal organs. And it also plays a role in taste sensation. The motor part provides movement to the throat and soft palate, which we will look at in a minute. The parasympathetic function regulates heart rhythm and innervates the smooth muscles in the airway, the lungs, and the gastrointestinal tract. Alright, I know the body is pretty incredible. So what we're going to do, like I mentioned, we will test the 9th and the 10th nerves together. I'm going to start by observing whether your palate elevates normally and symmetrically. So open up and say, oh, hold on. Okay, your tongue's in the way. I'm going to just use this to press down your tongue. And I'd like for you to just say, ah. Okay, good. So what I'm looking for is I'm just making sure that your velum or your soft palate elevates. So when the velum elevates, it actually, it seems like the opposite, but when it elevates, it closes off the airway to your nasal cavity. Okay, so and then stop. Okay, good. So when you stop phonating, the velum should depress, which it did. Now I'd just like for you to give me 3 ahs in a row. So ah, ah, ah. Good. All right, now one more thing. I'm going to have you say ah, and I'm just going to pinch your nose, okay? Ah, good. All right. I'm just going to feel the back of your throat, not so far to elicit a gag reflex or anything, but can you feel that? Okay, good. Alright, so now I'm going to test your accessory nerve. That is the 11th cranial nerve. That provides motor function to some muscles in the neck. It also controls the sternocleidomastoid and trapezius muscles that allow you to rotate, extend, and flex the neck and shoulders. So what I'm going to do is test the strength of those muscles. I'm going to test the trapezius muscle by having you just shrug against the resistance of my hands. So I'll place my hands on your shoulders and I'd like for you to shrug them upwards. Very good. Easy enough. Alright, now for the sternocleidomastoid, I'd like for you to rotate your head against the resistance of my hands on each side. Sorry for our dog. Alright, so I'm going to put this hand here. Just rotate your head against it. Okay. Very good. Okay. Good. And now this one. Very, very good. Perfect. Alright. Guess what? We are at cranial nerve 12. So this is the hypoglossal nerve. It supplies the tongue muscles. And I don't know if you're aware, but the tongue is pretty incredible in terms of the articulatory movements it makes. So it's very important to make sure that is functioning. So disorders of the hypoglossal nerve can cause paralysis of the tongue, most often occurring on one side. So I'm going to have you stick your tongue straight out and just peek at its symmetry. It looks great. Alright, so I'm just looking at your tongue, making sure it's not deviating to one side. Especially if ALS is a consideration, vesiculations are what I want to just make sure I'm looking for. Those are involuntary rapid muscle twitches. They're typically too weak to move a limb, but we do see them in places like the tongue and the eyelids. Okay. Now I'm just going to have you stick your tongue against your cheek like this. Okay, and I'm just going to try to push it back into its place. I'd like for you to just resist while I do that. Just going to push against your cheek. Good, okay, and the other side. Good, very good. Okay. Well, I hope that wasn't too scary for you. You did a really great job. And I don't see any issues. So you have my okay to continue on doing what you're doing. Just, always try to take care of your head. There are a lot of things that can come from traumatic brain injuries, so take care of yourself. Alright, I will see you again